when we were planning this first ever mini medical school of palliative care, we wanted to be sure that you all came away with a really good understanding of what advanced care planning is and how vitally important it is to you and your families. So it's with great excitement that I get to introduce Dr. Nathan Fairman, whose talk is titled Good Stories Have Good Endings. On a national level, Dr. Fairman has given scores of presentations and is widely published in the areas of palliative care, psychiatry, and bioethics. But within our own medical system here at UC Davis Medical Center, Dr. Fairman is the one that we all go to with our most complex cases when we need help, when patients and their families are struggling with serious medical decisions. He has a extraordinary, almost magical ability to help sort through medical information and help people figure out what matters most to them. And that's what advanced care planning is all about. So please join me in welcoming Dr. Nathan Fairman.
Thank you, Annie. Can you hear me okay? I'm also a graduate of the other UC Davis Medical School. Not the mini medical school, the other one. And when I was, when I started as a student, the school was still, half of the school was still in Davis. Now the whole school is consolidated in Sacramento, as you know. But we had a lecture hall that was a lot like this one. And for every class, I sat in the back corner. So I have a special affinity for you. Yeah. So I'm going to say three things. And they've given me, I think, 20 minutes or a half an hour to do it, but it doesn't take that long to say three things. So I'll say them now, and then I'll add some detail, and then we can have some questions, okay? So the three things are, first, your life tells a story. And the second is, good stories have good endings. That's our title. And the third is that advanced care planning helps you write the end of your story. So I'm done. That's it. Okay? Your life is a story. Good stories have good endings. And advanced care planning helps you write the end of your story. Okay? So each of our lives tells a story. Your life, my life, yours, Dr. McMillan's, Dr. Hargadon's. Each of our lives tells a story. Think of that. This room is filled with unique stories. And the stories have a plot, and they have a setting, they have a main character, that's you. They're supporting characters. The stories have drama, comedy, tragedy. The stories have an arc. They have a beginning, a middle, and an end. They have conflict. They have resolution of conflict. For most of us, they have coming to terms with conflict that won't be resolved. But each of your lives tells a story, and it's a unique one. And good stories have good endings. So let's go a little deeper. All right. So what is advanced care planning? You've got, in the packet in front of you, there's actually a definition of advanced care, of an advanced directive, and I think in a definition of advanced care planning too. And there's a bunch of resources. So most of the stuff that you get from this talk, you'll take with you when you leave, and it's in your packet. One way to think about what advanced care planning is actually to address what it's not. So it's not the story. Your life is the story. Don't mistake advanced care planning with the story. It's not a document. Advanced care planning is not a document, although there are two documents that are commonly part of advanced care planning, and we'll talk about those in a minute. Those are an advanced directive and a POLST. It's not scary. For many of us, thinking about coming close to the end of our lives is a bit scary, but advanced care planning enables us to continue to be the author of how that story unfolds. Advanced care planning itself isn't scary. And then lastly, it's not something you should put off. You have an opportunity when you're doing well to plan for the future, and you should take that opportunity. It's not something you should put off. Okay? So I would think of advanced care planning as the process that you use to help write the end of your story. Now, why is it important? Why does it matter? The main reason it matters, I would argue, is that what people want is often not what they get. Let me explain that. The way I imagine my story unfolding, the chapters that are yet to be written, the way I imagine it unfolding may not be how it happens for me. And advanced care planning allows me to have some control over it. Now that happens for a couple of reasons. One is that as we get close to the end of our lives, the circumstances of the end of our lives are often hard to predict, difficult to control. But this also happens if we fail to take the opportunity to plan. That's what advanced care planning is. So what do people want? We're going to get into a tiny little bit into some data here. What do people want? If you ask people to imagine the last months of their life, the last weeks, hours, minutes of their life, if you ask them to imagine that, this is the kind of thing they picture. Being in home, surrounded by familiar things, surrounded by things that you love, 2 dogs and a cat for this gentleman, right? This is a sort of scene, the sort of setting of an end-of-life experience that most people kind of conceptualize. We want, in general, to live life to the fullest. And if we get sick, we'd like our diseases to be fixed, cured. We'd like them to be gone in order that we can live life to the fullest. And we'd like to make sure that our suffering is relieved. 90% of these are surveys from Americans, believe that family ought to participate in care near the end of life, and 90% of us, 9 out of 10 of us, would prefer to die at home. That's what we want. But what do we get? Well, we get something that looks a little bit like this, often. So, a patient whose face we don't even see, surrounded by all this incredible technology, say an intensive care unit, with a doctor speeding out of the room with his checklist under his arm. Now, this is not an indictment of technology. Technology is the reason why we now live to be 80 years old instead of 40, like we did in the early 1900s. It's actually the success of our medical technology that's put us in the position of having to make choices between quality and quantity of life. It's because we're so successful at prolonging life that we're now faced with decisions about trade-offs between quality and quantity. But this is the kind of thing people often get if they don't take the opportunity to plan in advance. Eventually, all of us will have an unfixable disease. Though we want our diseases to be fixed, all of us will have an unfixable disease. About a quarter of us die at home, although 9 out of 10 of us prefer to die at home, and the rest, 3/4, die in institutions. So it matters because advanced care planning gives you the opportunity, within some bounds of reason, to have an end-of-life experience that you want. All right, so let's get into some details. There's some practical parts and some important parts. We'll start with the practical ones. You have to do both. You have to do both the practical ones and the important ones. I would say there's really 2 practical elements of an advanced care plan. One of them is called an advance directive, and the second is called the post. They're the most concrete parts of advanced care planning. And in your packets, in the very back of the packet, you have a bunch of resources, including a blank sample advance directive, and you have a hot pink sheet that you can't miss. That's called the post. Okay, I'm not going to go into great detail about both of these documents because the resources I've given you will let you peruse them in more detail. But briefly, an advance directive has two elements. One is called a living will, and the other is called a durable power of attorney. The living will is the part of the advance directive where you indicate your general preferences for treatment in the event that you become seriously ill, critically ill. Would you want to have chest compressions to try to restart your heart, to be shocked if you needed it, to have tubes into your lungs and connected to a breathing machine? Those sorts of interventions. And the living will part of the advance directive allows you to indicate, in general, what some of your preferences are. The other part, which is so valuable to us as palliative care providers, is the durable power part. And that is the part where you designate a person who could speak for you in the event that you weren't able to speak for yourself. If you can speak for yourself and make choices, you don't even need an advance directive. All of this is moot because we just talk to you. We find out what your preferences are, what your values are, and we match the right treatments to those preferences and values. But in the event that you're not able to speak for yourself, the surrogate is tasked with doing that. Now, how many of you, I'm curious, how many of you are aware that you are designated as someone's surrogate? But good, okay, it's probably 2/3 of you. One of the common, I would say, misunderstandings about the role of the surrogate is the idea that the surrogate's job is to make choices for the patient who can't choose for themselves. Now that's an easy misunderstanding to make, and in fact, doctors often tell patients that that's what they're supposed to do, is to make choices. But that's not exactly right. The surrogate's job is to tell the doctors the choices that the patient would make. It's to help me understand what choices would your loved one have made given the situation they're in. And that's different from choosing for them, right? So there are two parts of an advance directive, the living will and the durable power. The PULSed is similar. That, by the way, an advance directive is something that anyone who's an adult should have. It's a good idea for anyone who's an adult to have an advance directive. The PULSed is similar but a bit more specific, and it's really important for anyone who's been diagnosed with a serious illness, and especially anyone who has a very advanced stage serious illness. The PULSed is an order by a doctor. PULSed stands for Physician's Orders for Life-Sustaining Treatment. So it's that hot pink sheet. It's in your resource packet. And it's a sheet that you use to indicate whether you would want to, essentially to be brought back to life, if it's possible. Whether you would want feeding tubes. Whether you would want to be taken to the hospital in the event that you are critically ill. So that the scenario is you're at home and you've had a heart attack, for example, or a stroke, and 911 is called, and the emergency medical services personnel come, and they see that hot pink sheet on your refrigerator, or they show up at the door and they say, do you have a PULSed? And the PULSed helps empower them to treat you the way you want to be treated. If you don't have a PULSed, they'll do everything they can to keep your body alive. And sometimes that is what you want, and sometimes it isn't. So the PULSed empowers them to treat you the way you want to be treated. So advanced directive and PULSed, those are the practical parts. But the important parts, the super important parts that people forget about, is that you've got to talk about this as a whole process to doing advanced care planning. And it involves reflecting on what your values are, what your priorities are, what matters to you, what you're willing to endure, what you're not willing to endure, thinking about those things and then talking about it to the people who matter in your life, and especially your surrogate. And in particular, if you have a good relationship with a primary care doctor, talking about it with your primary care doctor. So you've got to talk about it. It's a process, as I mentioned. Circumstances change, priorities change, and so you need to revise and revisit your advanced care plan as you go forward in life. And you also need to expect the unexpected. So practical parts and important parts, okay? A couple things to think about to help prepare you for doing a useful advanced care plan. Some things that you should think about when you talk with your doctor, some things you should think about for yourself. So first, when you talk to your doctor, you want to ask them, when they're sort of suggesting new treatments for you, you want to say, will this make my life better or longer? That's the level on which you should be having a conversation with a doctor. Is this treatment you're recommending going to make my life better or longer? Or both? If your doctor says both, then that's the end of the conversation. You should do it, right? Right? If the doctor says neither, you should be a little puzzled. Why would you do something that's not going to make your life better or longer? The trick is that as illnesses advance, often we can do one or the other, but not both. And you are the expert in your values and priorities, and you are the expert that can figure out whether the treatments that are being recommended make sense for you. Okay? Will this treatment make my life better or longer, and how? In what ways? And if this doesn't work, what can I expect? If this treatment doesn't work the way we're hoping for, then what will happen? You want to be educated about that. All right, but for yourself, you've got to think about quality of life. Quality of life is kind of a vague concept, so I have a couple other questions that can help sharpen it for you. If your time were short, what would matter the most to you? If you knew that you had 2 months to live, how would you want to spend it? What would your priorities be? What would a good day look like for you? You also want to think about what worries you about your future. What do you want to be sure to avoid? What trade-offs are you willing to make? What are you willing to, or unwilling to sacrifice? And then lastly, if we can't deliver with plan A, what would a plan B be for you? Would a plan B be acceptable? Okay, so those are some things for you to think about as you're going through the process of developing an advanced care plan. And then there's some resources that will help you with this. Probably far more useful than this 20-minute talk is to spend some time with these resources. So, and these are all in your referenced in your packet. So there's a couple of really helpful books that have come out in the last 3 or 4 years. Each of these is excellent. I would recommend in particular the first one. I know many of you have read this. Atul Gawande is a surgeon in Boston at Harvard. He's also a writer for The New Yorker, and he writes very cogently about his own experience as a physician providing for patients with unfixable diseases, and then as a son, helping to take care of his father near the very end of his life. It's very touching. There's also a bunch of really helpful websites with practical, specific information about developing an advanced care plan. And I'll put, any of these is very helpful. You actually, the one that's second from the bottom, the conversation project, we've included in your packet a guide that the conversation project provides to help take you through some questions to think about advanced care planning. I've done it myself. It's very helpful. It kind of prepares you for a discussion with your loved ones or your physician, and that's in your packet. And then lastly, the Coalition for Compassionate Care of California, I would credit with developing the POST law in California, and they have a bunch of helpful resources about palliative care and advanced care planning. So here's sort of a prescription for you, okay? The prescription is you want to prepare, and you can use the things to think about. That's where I suggested what you should ask your doctor and what you should think about for yourself. And you should use the resources that are in your packet to help prepare. Then you want to discuss some of these things with the people that you care about and the people that care about you, especially with your surrogate. You want to complete 2 documents, an advance directive and a POST. You should probably discuss it with your physician. And then you should repeat as needed. That's the prescription. Okay? So your life tells a story. Good stories have good endings. How will the end of your story go? Thank you.